Good afternoon. My name is Nefertara Best, and I'm here today with Q City Metro to have an important conversation about mental health. We know that mental health is such an important topic in our community, so I'm excited to be here today at Hopeway in South Charlotte to learn more about their services and to really unpack this important issue. So before we get started, I have two special guests here with us today, Dr. Coley and Ama, and at this time I'm going to have them introduce themselves.
Hi, my name is Ama Owusuwa. I'm a licensed clinical mental health counselor, and I'm also a supervisor, and I'm one of the primary therapists here at Hopeway.
Hi, I'm Dr. Taryn Coley. I'm the Director of Outpatient Services here at Hopeway. I'm double board certified in child and adolescent as well as adult psychiatry.
Thank you, ladies. So before we get too deep, let's go ahead and learn a little bit more about Hopeway. Tell us, what does Hopeway do?
Yeah, absolutely. So Hopeway, we're a mental health facility here in Charlotte. We offer a few different levels of care. We offer residential level of care as well as day treatment programs for adults aged 18 and up. And we also offer outpatient services where we're able to serve children, adolescents, as well as adults.
Well, it sounds like you guys are doing amazing work here in the community, so I'm grateful to get to talk to y'all today. So let's just level set a little bit about mental health because we know it's such a hot topic, especially in the African American community. When we talk about mental health, what does that even mean? What does it mean?
So mental health is, it's universal. It's something that impacts our psychological, our social, our emotional well-being. It impacts how we perceive the world around us, how we interact with people, how we make decisions, and how we deal with stress. It's something that's important from childhood through our adolescence and through adulthood, really throughout our entire lifespan. Mental health conditions are illnesses that can disrupt our daily functioning. And so those might be diagnoses like major depressive disorder or generalized anxiety, bipolar disorder, PTSD, among many others. And really those can get in the way of us being able to be productive or in our relationships. And again, like how we're dealing with stress. And about 20% of adults in America will have a mental illness at some point in the course of a year.
Awesome. No, that's very informative. That's great information. Ama, do you have anything to add? Do you want to chime in?
I think Dr. Coley said it well. Mental health, of course, is more than just the absence of mental disorder, right? It's our ability to really be able to not just survive in the world, but also thrive as well, too. It impacts our decisions, right, who we're allowed in our lives, how we'll be able to thrive and also be able to contribute to our community as well, too. So it is a major aspect of our lives and how we're able to really move forward as well.
And I think we'll kind of talk about it too, like our mental health, for a long time, it's been seen differently from our physical health. But we know that both are really important to our overall well-being. And there's overlap. For someone that may have a serious physical health condition, they also might be at greater risk of developing a mental disorder like depression, and vice versa. There are some mental health conditions that might put people at greater risk of physical health conditions down the road too. So, unfortunately, there's been a lot of stigma around that, which we'll talk about, but we know that that it's really important to our overall well-being.
Oh, absolutely. I lost a loved one to suicide back in 2007. And ever since, obviously, I've dove in and tried to become a little mental health expert and advocate. And we just know that it doesn't always look like what we think it looks like, right? And that stigma is so powerful. So again, I'm just excited to have this conversation with you ladies today. And I mean, even when we turn on the news and just look at everything happening here locally in Charlotte and just around us in our country right now in this moment, I just want to ask, from your experience, you're seeing patients, you're doing this important work. Do you feel that as we, come out of COVID, hopefully, do you feel that in the past couple of years that there's been a rise in mental health instances, or have you seen an increase? I'm just trying to kind of measure if, what you're seeing on a regular basis.
Yeah, that's a really good question. I mean, the past few years have been incredibly trying times for all of us. I mean, the COVID pandemic, for sure, it's something like nothing, many of us have never experienced in our lifetime. And, from the social isolation to worrying about getting sick or seeing our loved ones suffer, it's been incredibly stressful. And so you don't have to have a mental health diagnosis for something to impact your stress level. But we are seeing more people reaching out for help for depressive symptoms, an increase in that, an increase in substance and alcohol abuse, because people are really trying to figure out any way to deal with the stress. And unfortunately, we are also seeing rates of suicide increase over the past decade or so. We just recently were looking at an article about that there's been a 12% increase in the rates of suicide over the past decade, with the fastest rates, unfortunately, happening in the Black and African American community.
That's a great point.
And also, too, when you top that with just the racial climate of our state as well, too, that definitely has also impacted a lot of things that's going on, and for the Black community to also increase awareness and be able to seek mental health as well, too. So it's kind of like dealing with just COVID, but also just dealing with the racial disparities, right? And also just reliving trauma after trauma. And so a lot of times just recognizing that and wanting to break that generational trauma and that cycle. And so I think now people are more aware of it and want to really start being able to really take care of themselves and realize that the way that we're coping hasn't really been helpful as well, too. Yeah.
And I think that statistic that, always sticks with me is that 1 in 5, right? Yes. 1 in 5 people will be diagnosed with a mental health disorder. And so that really brings it home. Do you feel that people are seeking out the treatment that they need? Do you see that there are any barriers that are stopping people? Can we talk a little about that?
I think generally, in our society, there's a stigma around mental health, just in general, that is often seen in a derogatory way or with prejudice, right? There are certain stereotypes around it, and that can really put people at a distance from seeking out help. I think additionally, within the Black community too, there's further fear that if you have a mental health diagnosis, that you might be further marginalized or discriminated against because of that. And so it's really hard to feel like you will have a voice to be able to reach out for help. Other barriers are just the fact that mental health services in general are lagging behind medical services. It's a lot easier in most circumstances to get seen about your physical health, but the services for mental health are much limited, in the Charlotte area, but nationwide. And so it's really challenging to get that care that you may need.
And also a lot of times too, mental health is looked at as seeking help is looked at as a weakness, right? Like you have to be strong, you have to keep moving forward, you have to pull yourself up and keep going. And so a lot of times asking for help is seen as a weakness as well too. And of course, in the Black community, faith and spirituality is really important for us as well too. So a lot of times when we are struggling, we sometimes internalize it and see that as something that we're doing wrong, right? Or we're not praying enough, or something is wrong with us as well too. So we struggle to actually be able to really ask for help because we think it's something that we're doing wrong as well too. So that can sometimes become a barrier, even though faith and spirituality is a resiliency for us, but sometimes we need more than that as well too. And being comfortable to be able to ask those kind of questions is extremely important. And I think recently the stigma is lessening a little bit with celebrities, social media, right? A lot of people are more normalizing talking about our mental health and seeking help as well too. So that has helped a lot of people be more comfortable and open to talk about it. And even like having, who was it? Kendrick Lamar, right? His recent album talking a lot about seeking therapy, and that in itself has opened a lot of people's eyes and wanting to actually seek help and know that we don't have to go through this, that there is help out there as well too. So I think definitely the stigma is getting better, but of course it's still there as well too.
Yeah. And I think these kinds of conversations are just so important at normalizing it and, making it known that these are brain diseases, just like we have physical health diseases, and that someone may need treatment for their depression just as they may need treatment for their diabetes, right?
Absolutely. I love that. That's a great point. And that's something that we talk about often in our family. It's just that it's no different than being diagnosed with cancer or any other ailment, right? It's just, I love how you said it's a brain disease. And so thinking about it from that perspective. Yeah. So this is the perfect segue. The next thing that I want to touch on is, how do you tell if someone is struggling within that mental health space? Again, as someone who's been impacted by suicide and mental health, in hindsight, I can see the signs, but when I was in the midst of it, didn't quite catch them. So you two ladies as professionals, I think, I would love to hear And I'm sure our audience would love to hear if you can share just some tips or some warning signs that people can look out for if they're really trying to assess if their loved one is in need of some support and some resources.
And I think that's a good question, right? And I think sometimes mental health shows up differently for different people, right? So sometimes people can really be good at masking, and so put on a happy face. They don't want to burden their loved ones, so a lot of times they can hide it very well. So sometimes there's some subtle signs that you can notice. A lot of times could be just neglectful of just their daily hygiene, not taking care of themselves, right? Sometimes isolating more, withdrawing, right? Or neglecting their responsibilities. And so sometimes that's something that we can notice as well too. Mood changes, right? Sometimes irritability, anger could be one of them, because sometimes anger is an easier emotion to express than other emotion as well too. But that can definitely be a sign that someone is struggling as well too. And then all the people who are very routine and structure, sometimes when we see them go off that routine, it's a great sign that maybe something is going on as well too. And so sometimes it can be easier to notice, especially if you live with them and we know their routine and how they function and how they are on their baseline. But it's a lot harder when we don't live with them as well too. And so sometimes those subtle signs, sometimes realizing that they have canceled a lot of different activities with you for a while, that could be a big sign that something is going on. How they're talking, right? Are they very hopeless? Is the conversation very negative? That could be a sign that they're struggling as well too. So sometimes it could be subtle and sometimes it could be very apparent depending on what they're doing and how much they're struggling as well too. But a lot of times those specific ones are the main ones that is easily noticeable. It's when they start neglecting their responsibility and stop taking care of themselves as well.
Those are great ones. What about you, Dr. Cole?
Yeah, I was just going to add for children too, there's some similarities, but some differences. We might see a lot more behavioral changes and just like acting out or tantrums or irritability. You might start to see them also withdrawing socially or the grades declining. A lot of kids will try to escape with using video games as a way to avoid and kind of isolating themselves in that way. They often don't have the vocabulary to be able to talk about how they're feeling in the same way that we can as adults, which is why we may see more of the behavioral changes. But they also may complain more about physical complaints as well. So having tummy aches and headaches and not, there's not just one single thing out of that means, okay, there's an issue, there's a problem, or my kid's depressed just because they don't want to go outside and play. But if we're looking at the bigger picture, we're looking for patterns and at least approaching things with a curiosity to begin asking questions to find out what's going on.
And also to kind of also piggyback off that, sometimes too, how we cope with stress and mental health is also a sign to watch. Like realizing that if they're using self-destructive behaviors or using specifically like substance to cope, if you notice they're drinking a little bit more or using or smoking a little bit more, right? So those type of things is something to look out for, or engaging in very impulsive behaviors, right? That's something to be mindful of as well too, that someone might be struggling and figuring out how to cope with it, but doesn't know how to really articulate what is happening to them as well.
Great. I think those are all great things. And as you're saying them, I'm like, I think that sometimes when you're in the midst of dealing with a crisis or dealing with a loved one that is struggling, some of it seems very common sense, right? But, to hear you ladies say it, I think that it really drives it home. So let's talk a little bit about just what treatment options are available, especially here at Hopeway with all the great work you guys are doing. What treatment options are currently available that you can share with our audience?
So, oftentimes the first step when someone needs mental health services is to reach out to your doctor. And sometimes that may mean reaching out to a primary care doctor or a pediatrician first, because that's the doctor usually that you're seeing the most often, right? And that may lead to a referral to see a psychiatrist. At Hopeway, again, we offer outpatient services for children, adolescents, and adults. And a psychiatrist will complete a comprehensive evaluation to understand diagnosis and to begin building a treatment plan. And so that treatment plan might include medications, it might include therapy, or it might include like a combination of both. For folks that need more intensive services, Hopeway also offers different levels of care for adults. So intensive outpatient program is 3 half days a week of group therapy. Our partial hospitalization program is 5 full days a week of group therapy, as well as individual and medication management when needed as well. And then our residential unit is a 24/7 voluntary unit, which really just allows a safe place to focus on self and to foster emotional, healing.
And as Dr. Coley mentioned, that it is 95% group. And so a lot of times different topics that's covered in our programs, but in our residential partial, which is the 5 days a week, and also our IOP groups as well. At Hopeway, we really look at the individual in a holistic way. And so a lot of our programs target those. So we have the clinical groups, and we also have the integrative group as well too. And some of the groups that we offer are CBT. So CBT is cognitive behavior therapy, which really focus on challenging our thoughts, which would then change our emotions and hopefully change our behaviors. We have DBT, which is more about managing our emotions. We have other clinical groups include self-awareness, healthy relationships, relapse prevention plan, and the integrative aspect also include art therapy, horticulture, nutrition, rec therapy, and music therapy as well too. We also have relapse prevention plans, learning how to maintain the progress that you make in treatment as well too, and how to apply that once you go back into your regular lives as well too.
Thanks so much for having us. This is such an important conversation, and we're really glad to be a part of it.
And it's a conversation that needs to keep going, not just for July mental health, but as a whole as well too. So thank you.
I hope you enjoyed today's discussion as much as I did. I certainly learned a lot, and I hope that you and the viewing audience also learned a lot. I want to personally thank our friends here at Q City Metro for uplifting this important conversation for our community. I also want to thank both Alma and Dr. Coley from Hopeway. I learned a lot about them. I'm sure you all did as well. And on that note, we will see you next time. Thanks.